So today we'll be talking about MRI brain, and in the MRI brain this is a typical stroke protocol. Stroke protocol means where we can actually see whether a patient has an acute or new onset stroke or not. Now how do we come to know that a patient has new stroke or not? For new or acute onset of stroke, we always see DWI and ADC imaging. DWI is diffusion weighted imaging and ADC is afferent diffusion coefficient imaging. So this is typical DWI and this is typically ADC, and these images are always given in pair and almost on the same page or same film, because we can compare both the images. It is very important. An acute stroke or an acute infarct, not bleed, acute infarct will be seen as a dense white structure or a dense white lesion if it is an acute stroke. And usually this dense white structure or dense white lesion will stay white for around 7 days. From 7 to 10 days, then it starts turning black on the DWI. So if it is white on the DWI, then we always say that the patient has acute stroke, which is of less than 7 days duration. So we can very easily understand that it is an acute stroke by seeing the DWI and ADC. The lesion on DWI should be white, and thus at the same area on this ADC it should be black. If it is that, then we call it as acute infarct. So just see in this image. So this correspond to this these correspond to this correspond to this correspond to this correspond to this correspond to this. So the same way the other images correspond to that part, like this correspond to this for this for this for this, and so on. So what we see, a dense white structure should look dense black on the same respective image. So just see in here, you can notice there is so much whitishness in this MRI image. This is a DWI, and at the same area here, this is the ADC of this image, where you can see that there is dense black structure or dense black lesion in the same area. So this tells us that this is an acute infarct. So you can see in here there is dense white structure, here it is dense black. So this corresponds to this area, and this is an acute infarct. So the blackishness is here, 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 and it is patchy in this area. So there is patchiness. So this corresponds to all acute infarct, and we can very easily see in here that this dense white is all acute infarct. Now we should remember one thing, that how to understand that which artery is involved. Which artery is involved, to remember this is very easy. There are three main arteries, that is anterior cerebral artery, middle cerebral artery, and posterior cerebral artery. Middle cerebral artery mainly supplies most of the brain. So if these are the ventricles, these are the two ventricles, the anterior portion from this lateral ventricles is supplied by ACA. So this is all supplied by anterior cerebral artery. Whereas if you draw a line from this here, so this area is all supplied by posterior cerebral artery, and the middle portion of it is supplied by middle cerebral artery, which is the largest artery. So on an average, this is supplied by ACA, this is MCA, and this area is all PCA. And when we go above towards the parietal area, like this area, this is all supplied by middle cerebral artery. This is all supplied by middle cerebral artery. So these are upper cuts where you are not able to see any ventricle. Ventricle is not there. These ventricles are seen. These ventricles are seen. This is ventricles are seen. So where the ventricle is not seen, it is all supplied by middle cerebral artery. So this is the lower portion. This is the lower portion of the brain, and this almost the lower portion which contains the cerebellum, the brainstem, which contains the midbrain, pons, medulla. It is all supplied by posterior cerebral artery. So, in short, when we are talking about this occipital cortex, when we are talking about cerebellum, when we are talking about pons, medulla, midbrain, this is all supplied by posterior cerebral artery, whereas the thalamus is also supplied by the posterior cerebral artery, and some portion of it is supplied by middle cerebral artery also. So the occipital area, the thalamus, these are the structures which are supplied by the posterior cerebral artery, whereas anterior cerebral artery almost supplies the bilateral frontal lobes and some portion of the parietal lobe. And remaining part like this white matter, which is corona radiata, this is the corona radiata, the putamen, globus pallidus. So this is the caudate lobe, this is the internal capsule, this is the putamen, globus pallidus, the parietal region, this is like parietal region, this is all parietal region, and the temporal region, the temporal portion, the parietal region, it is all supplied by the middle cerebral artery. So in this case, this patient particularly had a large or complete obstruction of the left middle cerebral artery, presenting with a large ischemic stroke in left middle cerebral artery territory. And that's all for now, and thank you.